What are we discussing today?
We're going to discuss a very common and popular medical topic called hypertension or high blood pressure.
Wow, no more Waikiki?
We definitely have more fun stuff from Waikiki, but for now, given other priorities, we will focus on blood pressure today.
Why haven't you updated our YouTube channel for over 2 weeks at this point?
My apology. I have been super crazy busy over the past few weeks, but with some soul searching and Mushy's support, we're back, and I'm ready to make a transition on our YouTube hobby.
What transition?
We'll let folks know more as we update our future episodes. But the bottom line is, in order to transition our YouTube hobby smoothly, I have to cover a few medical topics before diving into some foodiness business.
Alright, let's go.
Howdy folks, welcome to our channel. I am Pushy.
I'm Mushy.
And we're the Pushy Mushy, yeah!
Serious.
So, B. serious is actually a gram-positive bacillus that has the potential to cause food poisoning.
Seriously.
We will do our best to combine facts with humor, but if we do make mistakes, please let us know and we will do our best to correct. Please like or dislike, hopefully not dislike, subscribe, comment, share, and press that bell icon.
Great. What is hypertension or high blood pressure?
Hypertension is...
You're a smart guy. You should know you need to explain what is normal blood pressure before discussing high blood pressure.
Wow. Cry hungry. You're right, as always. For adults, normal blood pressure is anything less than 120/80. Before going into further details, let's make a simple clarification. Notice there are two numbers. The first number is known as the systolic blood pressure, and the second number is known as the diastolic blood pressure. The science behind these two terminologies are not too important for us average Joes, in my opinion, but just to show off.
Showing off is not good.
I'm sorry. I meant to say, just to explain in a few words. Systolic blood pressure, or the first number, or commonly known as the top number, measures the force your heart exerts on the walls of your arteries each time it beats. Diastolic blood pressure, or the second number, or commonly known as the bottom number, measures the force your heart exerts on the walls of your arteries when it relaxes. Blood pressure can be checked at a lot of places, such as...
I know, let me talk.
Of course, my dear. Please.
Blood pressure can be checked at your doctor's office, outside of your doctor's office if you or someone you know can accurately take your blood pressure, or at various drugstores.
Having said all these, elevated blood pressure is a systolic blood pressure between 120 and 129, and a diastolic blood pressure less than 80. Stage 1 hypertension is a systolic blood pressure between 130 to 139, or a diastolic blood pressure between 80 to 89. Stage 2 hypertension is a systolic blood pressure greater than or equal to 140, or a diastolic blood pressure greater than or equal to 90. Please note, if you have trouble understanding your blood pressure, you should discuss with your doctor sooner than later.
You mentioned for adults initially. Are these numbers different for kids?
Yep. For children aged between 1 and 13, not including 13, based on one's sex, age, and height. Systolic and diastolic blood pressures less than the 90th percentile are considered normal. Those pressures between 90th to 95th percentile are considered elevated. Those blood pressures greater than the 95th percentile are considered hypertensive. Stage 1 and stage 2 hypertension also apply to kids, but these details are not that important for now.
What about kids older than 13?
Adult numbers can generally be used. Now, to be fair, no one expects anyone to remember what numbers correspond to what percentile. So I highly recommend anyone worried about his or her kid's blood pressure to have an open discussion with the pediatrician.
So, say I go to Walmart and decide to measure my blood pressure there. What do I do if my blood pressure is high?
So for both adults and kids, diagnosis of elevated blood pressure or hypertension is generally not made on a one-time deal. In this scenario, and anytime anyone is worried about his or her blood pressure, I recommend getting in touch with your primary care physician.
How is hypertension treated?
Treatment of hypertension can be complicated And I don't think we really need to go into all the excruciating details, but whenever possible, we try to treat the underlying cause of someone's high blood pressure. Let's leave medication management to all of the doctors and providers out there. Let's focus on some non-pharmacologic ways or lifestyle modifications to improve our blood pressure.
Why?
Because hypertension has lots of potential long-term complications. And so if we can adequately and successfully manage our high blood pressure, the potential benefit is huge, not only for us, but probably more importantly for our families.
What are some potential health complications of long-term hypertension?
Many, but the big ones are heart attack, stroke, kidney problems, and sometimes death. Blood pressure is something that all of us can try to manage. So, let's do this.
Let's do this.
Was that necessary?
It was fun.
So, let's talk about a few things that we can do to help everyone fight this thing called hypertension.
Number 1, dietary salt restriction.
If you want numbers for adults, a reasonable goal is to reduce daily sodium intake to less than 100 ml equivalents, or 2.3 grams of sodium or 6 grams of sodium chloride per day. But honestly, who really has the time to measure all the salt out every day? And therefore, we suggest you to simply cut down on your salt intake.
Number 2, potassium supplementation through diet.
Unless you have access to dietary counseling, this is not super easy. But some potassium-rich food items include fresh fruits and vegetables, such as bananas, oranges, honeydew, grapefruits, prunes, raisins, dates, spinach, broccoli, pumpkins, and leafy greens.
Number 3, weight loss.
We will talk more about weight loss later, but on average, every 1 kilogram of weight loss can potentially decrease blood pressure by 0.5 to 2 millimeters mercury.
Number 4, DASH diet.
DASH stands for Dietary Approaches to Stop Hypertension. I wouldn't remember all the food items within the DASH diet, but I do want to highlight the importance of diets in influencing our blood pressure. If you are interested in the DASH diet, please feel free to look it up on the internet. But again, I think you can use it just as a reference. And I do not really think it is necessary to commit the DASH diet to memory. The big picture is that our diet influences our blood pressure to a huge extent.
Number 5, exercise.
I encourage all forms of exercise. Obviously, don't overwork and hurt yourself, but I encourage all forms of exercise. If you want to be specific here, perhaps consider to focus more on aerobic exercises.
Last one, number 6, limited alcohol intake.
Men should drink no more than 2 alcoholic drinks per day, and women should drink no more than 1 alcoholic beverage per day. Now, this is not taking a lot of things into consideration, such as other comorbidities like liver disease, or maybe potential situations such as pregnancy. This is only focusing on the blood pressure aspect. We're the Pushy Mushy. Thanks for watching.